Even other countries are saying less than that.
Yes.
But in the Gambia, we consider in the 24 hours period. So this child should be receiving the vaccine within that particular period. If there is delay in receiving the vaccine at that particular period, the efficacy of the vaccine reduces once the individual is being given the vaccine.
Okay.
So you can see that it is more effective in the sense that it does the prevention well of that particular child not contracting hepatitis B in his or her lifetime than when it is given later on in life. You understand? So this is the importance of following the schedule. While if you don't follow the schedule, so what will happen is you will be given the vaccine, there will be protection, but the efficacy level might not be the same as when it should have been given at the right time.
Okay.
You understand? So the other principle is after ensuring that it is the right person and then at the right time, the child is receiving the vaccine. The other thing you have to ensure that as the nurse or as the caregiver that is giving the vaccine to the child, you have to ensure that the vaccine is being given through the right route. Because in the Gambia College, at the diploma level, they go through for 3 years of training. So in those 3 years, they have been trained in this route of in this administration, the routes that the vaccine is being administered. So the health nurse also have to ensure that that particular vaccine that he or she is being administered to that child has to be given through the right route that has been recommended by WHO or by the country that they are living within, because sometimes it might differ from country to country. Countries have their own standards and their own procedures, but most of the times it is a generalized standard worldwide. So it is recommended. So the individual have to understand that this is the particular route that this child is supposed to receive this particular vaccine. And also the individual, the other golden rule is the individual or the nurse have to understand the site at which the vaccine should be given, because there are different sites in the human body where you can administer the vaccine. But if you look at the vaccines that are being given, each vaccine has been designated at a particular site that it should be given in this country. You understand? So that to say that it makes life easy for us, like in the Gambia, everybody is given penta on the left thigh. You understand? So immediately a child received a vaccination and the child went home and then the child encountered some difficulties. Once the child returned to the health center, once we realize that it's the left eye, everybody or the public health officer or the nurse who is being trained on vaccination, we understand that this is the particular vaccine that is doing the problem. You understand? So the individual have to understand that. And I feel that every public health officer in this country, in the Gambia, in the college, they go through 3 years of intensive program training. And at the university, they go through 4-year intensive program training. And in that, they go for internship and then attachments post graduation. So I think they understand that well. And also the other thing is, the other golden rule is proper disposal of the waste. You understand? So because these women that are coming to the health center, they are coming to be prevented from diseases. So you as the healthcare provider, you cannot be negligent up to the state that those that are coming there to be prevented from diseases are acquiring the disease in that particular setting. You understand? So you have to ensure that there is proper disposal methods at place at the site of immunization. And I think any immunization setting in this country that you visit, you find that locally we call them the sub boxes or safety box. Immediately after the individual pull the syringe out, you see they will take it and drop it at in a box. So that is to ensure that it doesn't come in contact with the visitor, that is the caregiver who brought the child, and you, the health personnel also, it doesn't come contact in with you, and it is there. So that the individual is safe, the child is safe, you also as the care provider, you are also being safe. So you can understand these are the golden rules that most public health officers in this country all follow to ensure that this thing is being done well. That is to ensure that, and also like normally in the Gambia, our culture, when it comes to nurse, locally, as locally we call it, we encourage women to be coming early for nurse, so that because before we start the activity in proper, normally we wait until we have a reasonable gathering, then we start doing health talk, educating them, sensitizing them. This is part of it. Immunization is part of it. And also sometimes the sensitization topics are being derived from like the outpatient department, because at the consultation room, when the patients are coming in a week, you understand, then we'll go and revise what are the most common diseases or complaints that people are coming. For example, let's say Jambur as a community, because the facility is found in Jambur. So most of the people that will come, they will come from Jambur community itself. So after a week, if you make a review of the consultation book, you understand that maybe diarrhea is the most prevalent cases that are being reported at that particular week. So when you go for the next nurse, you ensure that your topic of presentation or sensitization to those ladies or anyone who come to attend the clinic is based on that topic, so that they will know and they will be aware of what is trending and what is going on at their own community or at their own locality. So this is the importance of following the schedule, and then if you miss it, does it mean that it is not going to have effects on you? Okay. It will, but the level of the efficacy will differ.
Okay, so 5050505, I mean, later we'll open the line, I mean, maybe in the next 10 minutes, where we will be inviting callers to come to call in and, you know, ask questions as well. Vaccination, vaccine dole bije kadi sunkutundingol iko 9 years pour que prevent isaye la wulu akana problem osoro mum vaccine ne ngoti
yeah vaccine o bije le kamin di
HPV
HPV human papillomavirus almani ka kan dan tol ka fo seketu pengo nyum pour seketu wala jaar
okay
bari
mo jamal man la o vaccine wala par ya mutako vaccine ni batin na fon na sungutu ndingol te dingol sotola
o bi jele o ko rumo lati kada ni nata jibe campaign nata banko ka mol ka sotol million ko dol ba support la dol bi je million ko ka support o ka sial so media lam ni do tata jaro sta ko nyim vaccine be nit ñi nekela ntol Gambia janne nimmol be outside wal yo information na adnan tol min bi jang tol mo jamal bi je kalal min ko dol bi je ni manta karam mo to e malong a vaccino nyi na kuma ya minti ete ni o mari ete ko la ko kana nyim vaccino a fay dunga ya kana ta na tar karam mo de fanam bolo fal so wala problem ut ara pengo nyi aka musol lel tanka seketola e ko lo fa cervical cancer okay ni tar karam mo to janni mbitala je fana yalan comme campagne ministry of health la ka anafe so nana ta wo fana ka leta safele ka ki karambu ngolto ka itandi la ko ni wati kare be fintila nangal kanne pour ngana nan karambu ngolto ka dinol pengo pour itol fana e dinol inform dinol ni tata suko ne ya fo le parents sole bani ara jibe mostly school jamal bije ka sonne de banko ka andum mo jamal le bije fana minuna dinol ka pengo only maybe ni ko 100 out of 10-15 wala binale ya fuko mbama kun kana pengota so ni nata nan karam muton ko dinol pengule ni na teacher sole interact ni pareta ngam mu fungata para pengo nga ko mayata muso la karola bakele seketo mu fenati mi ala ka muso batande na ta to certain stage ka muso fango bali dingolal yeah but comme misinformation on drum mol ka fuko apengo ni ata be balle dingola wo arumo ka siala kambe nana just like covid kete nyame na bad registration of fanan kamin ke no bira nata nan the same problem wala nata nan ya be mo kile ngolat
to nyalam saindung nkaje fanan kayto katral bulu katra guardian ol bulu wala mo kayt bulu ringoti mo jamal ka samba ka fa no kayto wodum altol ka mun do ko leke woto
wala tol ka fa English ka wala infant welfare cat di wala di wala no skato di wala information be ka tara wala balo di won ning force abe pengo mentala ala information be ka tara yer date required wala di won lum anyanda ka pengo ta wato min e ka sa fe wala bala pour muso ni ya sa faje asalon ko next nose ni ndekar minal na nose la e ko sa faye wolto ande nana ta lumina date receive fana be je lumine vaccine di won e ba sa fe la jël pour muso nyanga ya sute wonya bara kayto nyim fana ni adila it's not like yalan comme free lem muso lem ni adila dol bije ka jale ko kayto muta fenti dol ya be faram fan ha ni na tay nyinin ka dinni wala kete wala ko fa bak so sign ni na tanam ibe kayto sa fere ba dinni wala information be sa fere je tol fana fengo bam bloko no fomo e ka fomi my child form dol fanan ko wala use nga dinno wala information like dinno na wuluta la information nga be safe ni nga safe albama ala parents wala number communication pour communication o sone adal ngala information o be safe o kayto nyi nabal so information kilon ko la safata fanna no kayto bal like no kayto nyi hanna filter nin tol dunta na system o ko nga saj mbalo na nin kare alasta ka pengo minta pour nin tol fana ben na nos continue la nin dinni wonye ngalo mba star la dame ani mba ban na dame to
okay
yeah nos kayto nyi na kumaya molti andang ni na ta fana comme like dinni woni lafta ko wulu kayto fana nyi na the same thing na ta nos kayt kilo moy bol kamala na yala parents wala da ko menol na ta pour wulu kayto da
to yala wo kumaya ta bake mbadi ngolu hanisa ngal be programme o min jibe kanteng na jata kende abundale anatale Ministry of Health mbe nyimpengol la ko le kachakan wala mu vaccines ti woto hanisa ning Ibrahima yetenteng Ibrahima, so how do you people manage to get hold of those that skipped their vaccine?
Thank you very much. Normally what we do is we do defaulter tracing. Defaulter tracing basically means going into the community, door to door, compound to compound, or in certain settings where the villages are small, the village is small, and then you can be able to call everybody to gather at a bantaba or at a certain place. Then you do the screening, and then you give the vaccine to the kids who were due for that particular vaccine, and they didn't report to the clinic session.
Okay.
So in the Gambia, the most common strategy that we use is we use the defaulter tracing strategy. Because one thing that normally happens is once some of these mothers, they come and they receive the injection, let's say for the first time, because normally when something is being introduced to the body, it is foreign to the body.
True.
The body has never seen it or has never encountered it.
True.
It is foreign to the body. So the way it works is the body has soldiers, like at basic, maybe grade 7, grade 8, they will teach you about the human body.
Yes.
And one of the aspects that they will teach you is the blood. You have two types, the red and the white blood cell. As you go further, then they go into deeper aspects of it.
True.
But at that time, you have been told that the white blood cells are the soldiers of the body. They do the protection, you understand? You understand? So normally when this particular child that is being born newly, and then this particular child is being exposed to the vaccine, normally the body reacts to respond to that particular antigen or that vaccine that is being given to the child. So as a result, you see that the child will have fever, the body will be hot, and then maybe at the site of injection, you will see that sometimes it will be swollen, it will be red, or sometimes it will be hard. If you touch it, it will be hard, and then you feel that the caregiver might feel that, no, I've not taken my child back to the clinic again. So you see, those are the kind of individuals who will default, who will not return, and they will be due for a particular vaccine, and they will not get the vaccine. So I say one of the strategies to get them is to go to them. Instead of them coming now, meeting us at the health center, we go to them.
Okay.
So that's why most of the times you see here that in the community that people are going around compounds and then giving vaccination, and then people don't know what is going on. So sometimes this is the activities that we will be doing, because we feel that every child have the right, and then every child is entitled to receive that particular vaccine. So if they are not coming, we will be going to meet them and then give it to them.
Okay.
Because it is our duty also to be doing that.
So how do you manage, not to vaccinate a child twice?
Good. Thank you very much. One is the clinic card. The clinic card is there as an evidence that if the child received the vaccine, it is been, in fact, before the child will receive, in most cases, we document. And documentation nowadays is being digitalized. It's being digitalized in our health system. So when a child receives a vaccine, it is being recorded and then put into the digital system. So if, in case a mother comes and then claim that maybe she went to Jame Foundation, the child received the vaccine there, and she comes back to Fajikunda, the child receive another vaccine there, or let's say she claimed that the child had been vaccinated there, and nothing is being written on the card, there is a way to verify because it is digitalized now. They will just log into the system and see whether this child have truly received the vaccine. Because once the child received the vaccine, it will be in the system. Okay. It will be the system because it's a form. You just record and it is scanned and then it is dumped into the system. So once that is being done, the records will be there. You understand? So the other one also is like the clinic card is there. And also we have, before we have the manual recording books that are there. If the child comes, the child is being given a unique number, like the ID card. Everybody has a unique number, ID card, the NIN number. So these kids also that are coming for the vaccination in our health settings, each of them, once you are born and then you report to the RCH site for the first time, then the registration will happen. So in that registration, you will be given a code. That particular child will be given a code, and that code will not be shared with any other person apart from that particular child. So in most times, to get to the code also, we use the parents' information. You understand? So if we use the parent information, we can get into the child biodata and then know that these particular vaccines have been received by the child, thereby preventing the child being receiving double vaccination. You understand? But to say also that this vaccination, if you look some of the diseases, there are vaccines, we call them inactivated vaccines. The inactivated vaccines, mostly they are the liquid vaccines. And then, yes, for them, they are given more than one shot. For example, in our immunization setting in this country, a child that is 2 months old will receive polio. The child will receive polio again at 3 months. The child will receive polio at 4 months. You understand? This is to ensure that the child is being prevented from polio. The child has the immunity and the response needed to respond whenever there is polio outbreak or polio disease in the country. You understand? And also like the penta that she talked about, which is combination of 5 antigens. You have the tetanus. That is also a very dangerous disease. We understand that. If a child has it, the child cannot be able to cry and then the child cannot be able to breastfeed. So you understand, as a result, if you are not able to breastfeed as a child, there is no other means. So it is very fatal. You understand? So it is part of that particular combination, and you have pertussis, you have diphtheria. It is part of it. Is you have whooping cough, exactly. Haemophilus influenza type B also is there. Then you have the hepatitis, which is also put into that particular. So 5 of them in combination make us one vaccine. So they are given at 2 months, at 3 months, at 4 months also. You understand? So even if a child receives a vaccine at a particular place and the child went and received another shot again, it is still okay because it's just to boost the immune system. Because we have some of the vaccines, we give them first shot, and then later on in life, the child receives them, we call them the booster doses. It's just like you eat, and then you feel that maybe you need to stay, not hungry for the next 5-6 hours. You will say that let me wait until maybe next 2-3 hours, let me eat, so that when I'm going, I will not get hungry. You understand? So these vaccines are also just like that. So some of them, you need to give a booster in order to ensure that the protection is there, and then it is being maintained at the same level.
Yeah, so 5050505 is the number to call, 5050505. mbokk yi ubbi nañ line bi mun ngeen a call si 5050505 pour ngeen bokka si programme bi fii si QTV bu nekkee ne da ngeen bugg a call 5050505 moo nekk number bi ngeen a call pour ngeen bokka fii si programme bi di nga gis lépp loo xam ne bugg ngeen ko xam soo leen laajte rek suñ naataango yi ñu tontu leen 5050505 moo nekk number bi hani syndrome moo laftale pour nga long ñing vaccination o dindingo ñimbatala fo sanji jelu because mol ñantalo na hapo vaccination o ñanta stop la time jumale
okay sono ñing ko mayata dinno na pengo start anyanta katala fo sanji lul yeah no skaito bala wal bije bring ala wuluta time men kata fo sanjulul abe different abe different vaccine la tala bolel tala fo janna be sanjulul lo sotol panna tata fo 1 year 6 months soto pengo nyin wal ka banne min kanana walam supplement olti e kam fo vitamin aning deworming abakalla wala tala every 6 months la wat so interval ka taraje bari ka je muso kanana nos e nana ndron bi ay pesaro da mal so raset next time fana murunta na pesaro da masuta seta de tatem nana tana pesaro da masuta seta te baka pesaro kuma ya jibe ataka fo len tenin tara nos na di no baka
caller soto la hello caller hello assalamu alaikum assalamu alaikum okay nga continue
yeah comme like ni muso na tana ako ke akana na watu kala di no pesa damma kata ta ka fulu ko nto ka yani na tana nos ika pesa ro dammal ke bay abuka pengo soto so ital bu ko fana na kuma yalan ko dindi wona na tana wati inyanta la pesa ro jibel fal pesa ro fa ka jile fa ka selele inyanto wolon na la musoto isaje dinni woni ni ataral pesa ro ka jinno so ko nyingal pesa ro be jikan isalo be minni mun ke lesa no so nyinen kanol foyete amante nyande kam munni mun ke pour ala weti na nan ko tenke mi ala kuma yata bakel
okay 5050505 it's the number to call if you have any question. My colleagues will answer. Of course, we have a caller on the line. Hello, caller. Hello. Hello, assalamu alaikum.
Hello.
Yeah, hello.
Assalamu alaikum.
Wa alaikum salam.
Assalamu alaikum.
Balal ñu nga wañi TV bi nga déglu ci téléphone bi. Okay. Koku dem na. If you are listening through your television set, please turn down the volume of your television and listen to us through the telephone so that we can have a good connection in the studio so that you can hear us loud and clear. Da ngeen a wàññi télé bi ñu mun a déggoo si biir studio bi bu dul loolu télé bi soo ko yokkee rek nga bugg a déglu si téléphone bi dafa écho te loolu mooy indi gàllankoor bi pour ñu mun a déggoo 5050505 mooy number bi. You can call that number to be part of the program here on QTV. Mr. Balde, okay, we have a caller. Hello, caller.
Hello.
Assalamu alaikum. Assalamu alaikum.
Hello.
Hello. Okay, he's still not getting
Hello.
it. I guess that caller can call again. Let's continue. Apart from vaccination, injections, what other things do you engage parents on?
Thank you. If you see that health is very diverse, and in the sense that for people to achieve good health, it doesn't mean they only need to be vaccinated to get that particular good health that they need. The other things that we also do is we engage in health promotion and sensitization at the community level. At different times you see us, we go into the community and then we have a community gathering where we talk to them about important issues with regards to their health, the community in general. And also we visit schools where we do school health talks.
Let's try this caller. Hello, caller.
Hello.
Hello, assalamu alaikum.
Alaikum salam.
Jërëjëf ñu ngi laa dalal si programme bi.
Waaw.
Tur bi ak fooy xoole.
man Ousmane Kin laa tudd maa ngi call Banjulunding.
Banjulunding ñu ngi laa dalal bismillah.
Wow, please, what I want to ask that
okay.
The vaccination they used to give our children, when it comes from America or from the West, do we have any laboratory here to test to know exactly what we are giving to the children, or we just give them as it comes?
Okay, the questions will be answered.
Okay, thank you.
Thank you very much. I think the question came at a better time. They are launching the National Laboratory for Medicine and Food, which is a bold step by the Ministry of Health. So I mean, you can delve into that.
We thank him for calling and asking a very important question. I think this is the way we can dialogue and then get people understand the importance of this vaccination and then how the vaccines are being handled in this country. Gambia being a developing country, we don't have currently the resources that could give us a lab whereby any vaccine that is being brought in this country is being tested to know all this. But one thing that I can say for a certain is these vaccines, they are unlike the medications that we have in our health settings. The vaccines are for prevention, and the medication that we receive, if you are sick, you go to the hospital, that you receive, most of the time those are for treatment. You understand? Once you have already been sick, you have been given those medications then to cure you. But for the vaccines, they are for prevention. And for the vaccines, they are not being run by an individual company or by an individual. No. The World Health Organization and Gavi, Global Alliance for Vaccine and Immunization, and also UNICEF. You understand? So these are the major players when it comes to vaccines development in the global setting. So each company that is been developing vaccines, you must be certified by WHO because you must have certain standards that you met for you to be allowed to do that particular production. And these companies are being well understood globally where they are, and they are the ones that supply vaccines. The vaccine that is in the Gambia, for example, let's say the hepatitis B vaccine, is the same vaccine that you will find in America. If you go to America, it's the same vaccine that you will find in the UK. You understand? Because it's the same company that is manufacturing them. You understand? And these vaccines, they are not being purchased by a government. They are being donated to governments. You understand? By WHO, by UNICEF, and Gavi. You understand? So this is the importance of the vaccines. And they are being tested in standardized labs globally. You understand? So after the tests have been done there, they are being certified. They are being certified. Then after being certified, that's the time they are being released, rolled out to different parts of the world, and then Gambia being also a beneficiary. So once they come in the Gambia, they are coming with a certificate that they have passed through all the stages of vaccine production. And there was proper supervision by WHO, UNICEF, and Gavi. You understand? Then these vaccines are being lancing now to be used in a global setting, but without which there is no vaccine that is being rolled out globally that has not been certified. Yes. So I hope that he got
yes, that answered the question. 5050505 is the number to call and be part of the program here on QTV. And of course, if you have any question regarding vaccines and vaccination, immunization, you are most welcome. You can please proceed and my colleagues will answer. Jenaba, Hanisa and left wrong. Altola Dulato, no sol kake time Jumale ani wati Jumale.
Like nte say my facility minto Jambu, na clinical like almost 5 clinics total saying. Every week. Nka clinical sotole every Wednesday. Ninka rolota first Monday nka clinical sotole wala mkata jambula dal na satel de ka fadame sinchang ketaya. Nkata wotole no botala the first Wednesday nka base clinical soto jambul loptano fonto jere.
Nga kola soto nga tanga muro. Hello kola.
Hello.
Hello, assalamu alaikum.
Maalaikum salam.
Ñu ngi la dalal sëñ bi.
Ala ñaadi.
Mbi jang kortanante.
Kortan.
Alhamdulillah. Todima ibe minto.
Oh, ndelo buba jamba njel.
Jamba njele. Bismillah buba.
Inside the canal lockdown always wati. This lockdown is very good. Me sister coming for on to anyati. Yalong bi ninke bukata lockdown, rebika lockdown o Kenya long. They always ngandi wa sambale. Nkata anka nyimpe saroke. Nkata mkolke. So wala na nibe kumo min for ka have interest pour nga diam.
Tonyale.
Yeah, because we even more market come back. We didn't know now be able to look at our Jaralola. It's a Fabukata, Babukata. Albicala Dino Kenya law. So it's very important to do more far from Kadu some other time. The learning combosa near moving in Doctor Minkabona Sanyang. They all knows me.
Tonyale.
So the system Bapla, Amin Bara.
Abarka. Amen, Buba.
Thank you very much.
Abarka. That's an exemplary father there, Buba. Thank you very much. Anyanta kala wala nyama. Ke oke inyanta ka simfaya tale purka jeko idim ila dimba kende ata. Katung. Entol ngalo nindingol sasata. Nka akamul batandi nyameng. So akumayata le ya prevent janning abe tinyaro kela. So iko alka no sol soto.
Nka no sol min soto every arabu. Like nga sinjam fale o ke soto first Monday. Ni bata je Wednesday. Nka base clinic ko soto nka min ke loptano kono je. Di upper Wednesday fana nka clinic do soto je ate kilon loptano roje. Just ngake min kam wala nyinde pour musol min yalon ko dolbi je baka chance to kanana ni clinic dola ya tra di other clinic pour yana ne di ngol pengota nga another clinic soto again third clinic ko min ka ben third week of the month fe and in fourth week fana of the month then the last clinic fana kamin soto wal ka ke sinci judomti o fana be jambur dala jel nga tawdo fana tol nga nyin clinical ke min kam wala nyinti dolbi je ni nate inomas wol ko ne nyin kay kamin fo wala nyinti loptano nying a jam fatan nale waranto man chance le soro kata loptano to dimbayal bem bulo kono dinnim fala bem bul dinnin sabal bem bulo kono to wol be sambal no so wada ma waka tinale muso dol bije bu kata no so nin tol fanan ka finti 5 kate no mas wol kon nka pengol diraje nyamna ku mayatal de etol fana ye finti na mol kan ena nan tol dammal nga do ko ke na nyoma ko pour na dinnol be tanka antol fangol ye tanka ko ran nyen
o muto nyalti 5050505, the number to call to be part of the program here on QTV. And for those of you that are listening via Q Radio 103.3, you can also call on that number. It's important for us to build a healthy nation, and the only way we can do that is to make sure our children are healthy. Once the children are healthy, we are going to build a proper, well-structured human race. Mr. Balde, let's still move on. Vaccine hesitancy.
Yeah.
Really affecting us as a people.
Yeah. Yeah. Thank you very much. I think that is one of the most important topic we can talk about of recent. I personally, as a health worker, I wouldn't blame those that are being hesitant of vaccines because, as you explained earlier, that you drop your wife to take this child to the facility to receive the vaccination, and you doing that because of as a parent and the love you have for your child. True. You understand? So the other person also that is sitting there, if you flip the coin, you realize that he is also denying the child the right to the right of vaccination because he or she feels that he's protecting the child also, that he or she don't want the child to acquire disease. Is the same thing, but that is all based on ignorance. And one thing that is also of great challenge for us is the COVID-19. If you look at globally the coverage, the percentage, for example, Gambia, pre-COVID-19, we were hitting the 80s and the 90% in terms of coverages for all vaccines, for most of the vaccines. And we can say that by that time, we had herd immunity in the country.
Okay.
But when COVID struck, everything was at a stand. The travel industry was at a stand, the tourism industry, the health industry also was affected greatly. In that, people started feeling that, well, it's a lie, and then it becomes a rumor, and then people spread it, and then it becomes something that people believe in, that COVID no more exists. And in early 2023 or mid 2023, vaccines were available, because when COVID struck, initially there was no vaccine for prevention of COVID-19. But later in 2023, I think vaccines were available, and then people were vaccinated against the COVID-19. So due to COVID, then this vaccine hesitancy develops, because many people didn't believe in COVID, or some of them because of the rumors that they are hearing that was happening, and they didn't believe in it. So as a result, vaccine hesitancy, even in this country, somehow elevated. You understand? So the only way that we could have bridged the gap that COVID-19 and vaccine hesitancy have done to us as a country is to collaborate with the global initiative called the Big Catch-up. The Big Catch-up was an initiative that was brought in by WHO, World Health Organization, UNICEF, Gavi, and other partners.
Okay.
So as a result, what they want was like the gap that was created by COVID-19 in terms of vaccination, to see that that gap is being closed. Because when COVID struck, you can understand that even travel was a problem, gatherings was a problem. So as a result, people were not coming in to receive their vaccines as much as they could have done prior to COVID-19.
Okay.
So this big catch-up initiative came in to strengthen or to close the gap. And then it started in April of 2023. And then it was rolled in Africa, Asia, and Latin America, I think. Yeah. So many countries benefited from it, and then the Gambia also benefited from it. Just 2 months ago, that it was on March, the Gambia had their own share.
Thank you.
Yeah.
Thank you very much, Mr. Balde and Jenaba, for coming. We've exhausted this time already, and thank you very much. It was quite a very interesting topic, and I hope to catch up again on another edition of this program. Yes. So viewers, this is all we have for today. Thank you, and we'll be back here again next week for another edition of this program. Until then, bye-bye.